Professional athletes are prone to clavicle fractures, which can occur from a fall or direct hit to the clavicle. The pain due to these injuries can often cause professional athletes to watch from the sidelines as their body properly heals. Today we visit Dr. Michael Meow, sports medicine orthopedic surgeon, to tell us more about clavicle fracture injuries.
A clavicle fracture is a break of the collarbone. Usually those occur when you've fallen directly on your shoulder, usually after a trip or a fall. The symptoms of a clavicle fracture are pain, sometimes swelling enough that you see bruising around the actual fracture site. The treatment for clavicle fractures depends on the degree of the injury. For a minor break where the ends are not displaced or put apart from each other, we usually have the athlete wear a sling until enough healing has occurred that we can start motion and physical therapy. If the fracture is significantly displaced or the ends are farther apart, that might need surgery where you would put either a pin or a metal plate with screws to hold the pieces together until it heals. An athlete can play with a problem depending on the degree of injury. If there is a minor break and there is sufficient time to heal in the first month or so, a non-contact athlete might have the chance to return to play. Contact athletes, however, need full healing of the bone before they return to sport.
The rehabilitation is difficult because it's just this little bone that connects the shoulder to the sternum. The main rehabilitation has to be to rehabilitate the entire shoulder, which means strengthening of those muscle groups around the shoulder, making sure the range of motion is achieved, because again, most of the time with clavicle fracture is going to be immobilized like this for 3 or 4 weeks, which then creates stiffness in the shoulder. So we need to really get rid of that. And that's going to take at least 4 to 6 weeks, professional or amateur. It's just going to take 4 to 6 weeks. Bone time to heal, and then get them back rehabilitation-wise to have a strong shoulder and prevent any problems.
We have 2 exercises with the shoulder. One, the external rotators, really important muscle group in the shoulder to help reduce incidence of injury in the elbow. And 2 is called horizontal abduction. So you're going to put his elbow on his knee, and we're going to slowly lower it down, controlling the fall, and then come back up. So that's external rotation, right? And goes out to here, and he slowly lowers it down, doing the eccentric loading to these posterior muscles back here. And again, we want to find a weight. We can do what? 5 or 6 or 8 times. Progress to 2 sets. We progress to 3 sets of 12 or 15 max. So 3 sets of 15 is max. If you can do that with no problem, you drop back down to 6 or 8 and add more weight. Always challenging the muscle to build back stronger. When we exercise, we tear down muscle, we want to build it back stronger. This one is going to exercise all those rotator cuff muscles. Thumb up position and lift it up to here. It's called horizontal abduction, right? And down again, slow. So again, to here, you don't need to jam the shoulder up and go all the way up to there. Just right to that position, just a little short of parallel to the floor, back down again. Believe it or not, the thumb up position is really important to isolate some of these muscle groups.
Be sure to keep these tips in mind when you prepare for sports and want to stay strong and healthy. I'm Molly Sullivan with SportsMD.com. Remember, at SportsMD, health equals performance.